Let's assume that we've looked through all this, we've gone through the labs, we've ruled out things like infection or certain electrolyte abnormalities, calcium being one of those that can certainly do it, or other diseases, right? Things that we always worry about, a cancer or something along these lines that could be causing memory loss.
Yeah, paraneoplastic type response.
Yes. That people would have. We go through, we do some of the checks, right? And indeed somebody's scoring low on their memory. Diagnostic wise, we can do some imaging. There are a few things that are reversible, but by far and large, most of dementia is a progressive disease of age.
It falls under Alzheimer's.
Yep.
I mean, the predominant one we see is Alzheimer's.
And so how do we help patients cope? And how do we help patients' families cope?
That's the thing.
Because one of the things that, for me, would be personally scary, right, is I don't want to ever have to lose my independence. I also don't want to be a burden on my family. And I hear this a lot from patients. I just don't want to be a burden on my family. It's always funny because families hardly ever look at it this way. But as patients, right?
That's the first thing you think about.
If it was my family member, I wouldn't think they're a burden on me.
No.
But I look at it from a personal standpoint saying, I don't want to be a burden. So how do you help patients and patients' families navigate these waters?
Well, I think at first you have to sit down with them and with your rapport with them and kind of talk them through what to expect. These are the things to expect. Help the families understand what to watch out for. Talk to them about medications to help maybe slow down the process. Support groups. There's a large amount of support groups out there for family members who are coping with the caregiver burden, even though, like you said, we don't want to feel that way, but there's a large amount of caregiver burden that goes into taking care of someone with Alzheimer's and dementia. I think counseling there, starting the medications if it's deemed appropriate, monitoring them closely, looking for any changes, acute changes, anything that help navigate with the family.
I think the key there, especially like you say with the family, the other thing that I see a lot of times when you get to this caregiver burden is, depending on what stage the family comes in, you just see family members that feel defeated. And not only do they feel defeated, they feel overwhelmed.
Exhausted.
And trying to remind family members so many times, this is not a sprint. We're in a marathon. And being sure that the caregivers take care of themselves as well. Probably one of the biggest things that I see for caregivers is they give everything and their all to somebody with dementia, and they don't take care of themselves.
They almost lose their identity in it.
And their health. And so, one of the greatest fears is, as a caregiver that I see coming in, is I won't be able to care for my spouse. I won't be able to care for an aging parent, and they sacrifice their own health in order to care for them, and then they end up in worse shape physically than the person they're trying to take care of. And trying to remember this is not something that is short term, this is something long term. And your mental health and your physical health are really important when you're trying to care for somebody with dementia.
Absolutely it is.
So, all right, well, I think, we have a lot that we could talk about with this patient. I feel like that with this, we would have a really good foundation to start, first from a diagnostic standpoint, as well as to continue to build that relationship, with them. And then as we progress, if this doesn't indeed turn to be dementia, then there's certain medications that you mentioned earlier. The medications for dementia right now, there's some new ones that are coming out.
Yes.
That right now show some promise, but I think there's sort of a mixed bag. Depends on who you believe.
The jury's out with it.
Yes.
There's no doubt the jury's out there, and we got some we've had around for a while that do have their place and that can put a foot on the brake pedal, so to speak.
Yeah, I was, I had an old Toyota pickup when I turned 16, and it had a parking brake on it that almost worked, right? And to this day, I can remember you take that park brake and you pull it out. But if you were on a hill, that truck would just sort of inch down the hill. And you could pull the parking brake harder and it would go slower, but it would never stop the truck.
That's it.
And unfortunately, with dementia, we don't have anything right now that puts the truck in reverse and backs it up the hill.
No, that's.
But everything that we can do a lot to pull that parking brake.
We can, and adding on the medications, and still taking the preventative measures and putting them into place, even after the diagnosis, is still beneficial.
And one of the, there's actually a book called the Alzheimer's Prevention and Treatment Diet, which is also another fantastic resource that, that's available on Amazon that you can get. But again, going through this Mediterranean diet, they'll actually go through, and the author is a specialist up in New York, and he says, with some of the dietary changes, and I hate to say, it's a good common sense diet, but he sees, at least initial improvement that is better than medication with some of those dietary changes than even just doing medicine alone. And so I think there's a lot that can be done for folks who come in, but we don't need to start with dementia. I hate to say we need to end with dementia.
That's it, diagnosis of exclusion.
Yep, and make sure that we rule this out with some of these other things prior to getting there, but that there's hope.
There's
right?
hope. There's definitely hope.
Even though I would say there's nothing that backs the truck up the hill, that doesn't mean there's nothing that we can do. There's a lot that we can do to help patients and patients' families go through this. It's not something that we can cure.
No.
But it is something that we can manage.
Yes, we can manage it.
So, all right. Well, I think we got a good plan here for this patient.
Ready to go see the patient?
Let's go see some patients.